This is Impact Healthcare, people and strategies that are disrupting the health benefits industry. And now, here's your host, healthcare benefits industry expert and the originator of the transparent health benefits movement, Lester Morales.
Welcome to another episode of Impact Healthcare live from Coral Gables, Miami, Florida at the U-Powered Symposium. Today is the last day, which you could probably tell by my voice. I've done a lot of talking, and I've got a very unique just character. I mean, they were going to say it. I mean, orange socks, blue shoes. He is the one and only Reid from Freshbenies. Reid, give me you, your company, and I always feel that the commonality, the common thread amongst everybody that we always have as a guest is that they wake up, they're salmon. They wake up swimming upstream. The rest of the world is going that way. They're going that way. That probably means there's a story behind that, a why, a mission, something that fires. If you have one of those, I would love for you to share that.
Thanks, Lester. Reid Rasmussen, Freshbenies is my company. Freshbenies as in a fresh approach to benefits. And we started our company 13 years ago because even then, the system was getting so complicated to actually be a patient in the American healthcare system, to be a person who got these benefits from your employer or on your own, but actually using the system was so complicated. And I really believed that there was a better way to handle that and a way to help guide people with some of these various tools that were out there that help people control their healthcare costs and confusion. But we got up every day to say we can do better at helping people make their way through the healthcare system so that they have a better life out of it. It doesn't cost as much. Their outcomes are better. And that truly is what's driven us every single day as we've launched our company.
We've had Nurse Deb on here a couple times, and she always says, like, we are involved in two of the most confusing ecosystems there is: health insurance and health care. And yes, they are different, right?
Right.
You said in your intro, American healthcare system.
What? Oh, did I say that?
That obviously means that you might hail from another part. So tell me about how that came to be, because that's your comparison point, right? That's what made the light bulb moment. Tell us about that.
Yeah, you're from Puerto Rico. Yeah. I'm from the other direction. I'm from Canada.
Okay, up and down.
So you had warmth and I had snowy Rocky Mountains that I grew up in. And my degree in Canada was health administration, which there means government and hospital. And I worked each about a year before skipping the border. And in 1991, I moved to the US. And here, when I engaged the healthcare system, I ended up getting a job for an HMO, which actually was a pretty awesome way to transition to start to learn the healthcare system. Worked for a Kaiser HMO in Seattle for many years. A few years, and then the Blues. And so I started to learn as much as I could about the American healthcare system, the insurance system. But man, even after like almost 20 years later, I was looking around the system and thinking, man, I'm still confused when I actually go to engage the system. And 2009, we were starting to see the ACA was looking likely, like it was going to ramp up. Across the country, the company I was working for, we were seeing those out-of-pocket costs rise and rise and rise, and in some places be upwards of $3,000 at that point in time. And I saw that the agents that we had that were working with our company were basically just sidestepping the, hey, how am I supposed to be a better consumer? Like we were telling people, be a better consumer, but we weren't handing them any tools. And what happened was I remembered some stuff that had gone on in Canada 20 years before. In the late 80s and early 90s, the medical market there crunched. They started to strip out anything that wasn't mandated out of the medical plans. And the response from the market was, hey, this government plan, it's okay as a basis, but it's not enough. And so there became these supplement bundles. Picture a Medicare supplement, except for every group plan you have in the entire country. So in Canada, these supplement bundles are the best-selling ancillary product in the whole country. And I can tell you where I was, it was June 9th, 2009, the light bulb went off in my head, and I'm like, oh my gosh. In America, with us going up and up on out-of-pocket costs, we're gonna need to supplement these new plans with consumerism tools that really help people actually navigate the system. And so if it wasn't for having seen a completely different healthcare model in Canada, I wouldn't have even had the light bulb moment that said what I need to do was quit my job and start a company and turn it into what turned into Freshbenies.
That is a fascinating story. I've actually never heard it. It's fascinating. and I've got
and Lester, we've known each other for years and spoken at different events.
I know, but I've never heard that. So let's dive into that, because you said a couple key words that are the foundation, in my opinion, about fixing healthcare, right? Which is engagement, right?
Oh, 100%.
Which is consumerism. My mom and I used to joke, like, how do you fix healthcare? I'm like, the problem with fixing healthcare is that the things that you need to fix healthcare, you'd never get as a politician. You'd never get elected.
Right.
Right? And so like,
100%.
you can't go it that way, so you go it this way. So maybe talk about, obviously not the commercial, but like talk about the tool that you created, because it's going to jump off on those key buzzwords, because without those tools, the word consumerism just means let's pass a bunch of dollars to the employee, make them think twice about accessing healthcare, which we know has resulted in really bad results. So talk about that.
Yeah, so there it was 2009. We were 7 years into consumerism plans. And some of those tools, what I saw was there were companies that were doing a good job on building these tools, and they were great for the very, very large companies. Back when you worked on the large enterprise sales, they were the kinds of companies that would implement these because they could put in some small little tool. I say little, I mean low cost, right?
Yep.
Low cost per member tool, because if you have thousands of employees, you're going to have no problem installing a telehealth program, which was a big deal and relatively new in 2009. I saw telehealth. I saw some navigation and advocacy tools. I also understood why small and mid-sized brokers, those that are working on groups of 1,000 and below, weren't installing these. Like, it wasn't even, we didn't even know they were there. Those on the very large knew it was there because they had the capacity to roll them in and actually build some engagement tools. They wanted to completely bundle a number of different things together, and understood in the main market of where the mass of employers are, it's the smaller and mid-sized employers, why those brokers weren't bringing that in. So instead of trying to say, oh, well, I'm going to go and create my own version of those things and build them myself, I said, what I want to do is pull a few of these that are fantastic together. And the three categories that we've really pulled together over the years are different versions of telehealth, different versions of advocacy, and savings networks. Put them into a bundle, and it goes back to that Canadian supplement bundle. Now, at the time, originally it was one set of bundles because it was solving most of what people were looking for. Over time, now we sort of have these different plug-and-play modules. And let's say you're putting together a complicated self-funded medical plan. You're looking to unbundle and then rebundle a lot of things together. Absolutely. On the medical and the medical management side, you're going to want to do that. But even then, it doesn't mean that with these tools that you need them all to be unbundled. And so even if it's the most complicated self-funded plan, having a set of these that are maybe rolling 2 or 3 or 5 different tools together and it being on a platform dramatically makes for a better member experience for that member. And what's fun then is if you even have like a small, fully insured plan, our tool comes along and dramatically helps that consumer who has this high out-of-pocket cost plan. So we have this plug and play that fits from fully insured all the way on up to complicated self-insured. I'm not sure if I answered exactly what you were asking, though.
No, but I think visually I want to say, now I am Johnny Lunchbucket. I work for a company. Talk to me about what happens. Like, how do I engage with the tools?
Sure.
Talk to me about the personification of it.
Sure. So here we are. It's say 10 years ago. Telehealth is the newest thing for everybody. So I'm thinking of a broker that we worked with in Tennessee, and they loved the concept of telehealth, and they could see how well that paired alongside a high out-of-pocket cost plan and a zero-visit telehealth. And we learned early we need to build some of that education and engagement programs that were turnkey from us, education programs, a good member experience, et cetera. And back then it was, here's your card and your booklet and call this number.
Right.
And I can remember a Harley-Davidson franchise. So you said blue collar, right? Like some guys just working in the franchise and working in the shop, right?
Yep.
But for them, the story was, hey, guys, why are you going to spend your Tuesday night waiting in line with your kid at the urgent care center and spend $163 if for no cost you could take care of this on your own? And isn't that better paired alongside this high out-of-pocket cost plan? And for them, it was about save a buck or two. And they had tremendous usage with us. At the time, I think they were running about 70% usage. So for every 100 employees that they had, and they had a couple hundred, they were about 100 employees, they were running about 70 visits a year, which in 2013 was like amazing usage, right?
Still today.
Right?
Right.
Because every one of those is saving on average $518. And today, that doesn't play out exactly the same way. The need is still there, whether it's him or whether it's the high-tech company that we work with. The purpose is different. Your education, your messaging to the Harley-Davidson franchise is, hey, don't spend the $163 if you don't want to. To the software engineer, it's like, why are you going to spend your time? But the tool was the same, which was, let's get some of that low-hanging visits and let's handle as much as we can remotely. And of course, nowhere in our SWOT analysis over the years did we ever say, what's going to happen is there's going to be a national pandemic, and on one day, everybody in the country is going to be told, go get telehealth everywhere, and forget all of the fight in the early days was, do we have proper electronic medical records? Is this secure? Is it HIPAA compliant? And they're like, cell phones, YouTube, use it all, to Zoom, like it just went out the door. But it's dramatically changed the awareness of telehealth, and then it sort of settled in after that first year when everything was free for those visits, and we're back down. The country today as a whole, a lot of, basically every medical plan has something of a telehealth built in. On self-funded plans, it's always being built in. Engagement should be so much higher, because the national average on engagement these days on a standard medical plan version of telehealth is about 15%.
Okay.
Man, Harley-Davidson in 2013 was 70%. Like, why are people still going back to these old habits? But it's about teaching consumerism in waves. So that was telehealth as an example there. Just because you asked about... I love it. And the word advocacy means so many different things to so many different people. When you think of that word, how you define it, and then talk to me about how enhancement in communication, putting it in the palm of their hands, really doing some better communication has enhanced that whole advocacy concept from a usage, and then I want to get into the outcomes part of that. It's interesting. You watch waves of the audience is ready for different things at different times. We included advocacy as part of our bundle in 2010. 2009 we were including advocacy in our bundles, but the brokers we worked with, the employers we worked with, and the members didn't exactly understand why that was going to be as necessary. The acceptance of a new idea comes in waves. People are ready to accept certain things when they're ready to. We included advocacy in our programs from the early days, and at that time it was mostly around, we can get you a little bit of guidance towards some providers, help you find some providers that are on your plan, et cetera, and we can help you with some medical bills. And for a lot of years, there was a little bit of acceptance and engagement with that, but a lot of people didn't see why it was near as important at the time. So in the early days, it was all about telehealth. And then as that out-of-pocket cost has risen, and today the average family of four will spend $4,200 on out-of-pocket costs after they've spent over $8,000 on their premiums, and that's with an employer-based plan, right? So it's a lot of cash. But that's 4,200 reasons to be pissed off at your medical plan. And it's 4,200 reasons that you're smacked with paperwork that shows how unsensical our gaming of the way our system works. And for all these years of consumerism, people haven't gotten good at learning about price transparency, et cetera. So today, where we saw the switch was, literally it was January of 2021, 2021. After 2020, all of a sudden the conversation shifted with every consultant and employer we ever talked to. And it went from all of them wanting to talk about telehealth first and maybe advocacy to, okay, we need some guidance. This thing is complicated. We're confused. And so for us, it's all across that spectrum now, and that a premium level advocacy service for us includes everything from that first touch point of who's the best quality doctor that you could pick. Okay, so you're on a new plan, Ms. Employee. And you need a specialist for your kid's specialty, you need a primary care for you, you need a primary care for your husband. Okay, where are you going to get that information? And after all these years, Google and Facebook is 72% of the place people go.
Wow.
Like, we're a sophisticated industry, and that's the best we've got.
Right.
So we've got data, a database with 13 billion data points to be able to say, we can tell somebody, okay, here's the 3 best that are in your town, on your plan, if you have a plan or a network or not network, and accepting new patients. And by the way, here's a whole stack that you shouldn't go to. And why? Because this one bills so much, this one goes too quickly to surgery, this one goes, they prescribe brand names far before generics. So we've got the data to find that. And number one, how difficult was that for the member? Super easy, right? They don't have to trust us too much to ask that question. And it starts to build the trust. You start to build a habit. Because what we're looking for is to start that member that we can be that guiding point, that if they've got a question, they aren't sure where to go, call the advocate.
Yeah.
And then these days, what we have found set up that's a great practice is there's one main advocate for everybody in that group so that they all get to know
Rebecca.
Yeah,
right.
Rebecca.
Right.
Oh, Rebecca's my person. You got Rebecca's phone number, you got Rebecca's email, and a fast response. So then you say, okay, well, I got to go for an MRI. I heard that maybe you could help me with that. So it's finding price and quality transparency and actually having a live body describe that price and quality work differently, the opposite in healthcare, because you need somebody who's going to walk these people through it, or they think we're trying to jam them into the cheapest, stop every surgery, like consumerism requires a conversation because it's backwards in healthcare. And you know this, and I'm just preaching to the choir.
No,
everybody who's ever been on your podcast is saying the same story, right?
And it's unreal. So I love to get people's perspective on, so you're sitting, pick the audience, a group of advisors, a group of employees, a group of employers, it really doesn't matter. Why do you feel that the resistance on the advocacy when we talk about healthcare is so far different than, I could just imagine now somebody saying, hey, I got up on Saturday morning, I drove to the first auto dealership that I saw, I got into the car, and I bought it, and I let them invoice me 3 weeks later. Like that, to everybody who just heard my voice say that, is like, that would be asinine. Nobody would do that. I would shop the heck out of it online. I'd look at Carvana, I'd look at Kelley Blue Book, I'd buy Carfax and blah, 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 and I'd do all of these things. And I think the stat I saw, an average person spends 39 minutes researching a car and all of that stuff before they buy it. But in healthcare, the thought process of asking about the price or the quality or just asking about anything so asinine. Talk to me about your perception of that, and like when you have a conversation, maybe like how do you guide that conversation?
Well, what's interesting is the consultants that I know, in the early 2000s, as we were moving towards as we were moving towards consumerism, we just said, hey, just start asking your doctor the price, start asking the drugstore the price, just start asking the hospital, what's the price on that? And I believed that consumer pressing on asking for price and quality would create a demand for price and quality information. Physicians and hospitals, they learned, here's what we do. So we are not wanting to answer that because they're in these completely different contracts where with this one carrier, they're going to get reimbursed for $8,000 for this surgery, and this other carrier, and they do a ton with them, and this other carrier where they barely do any, they're like, well, I don't even really do them with them, so why don't I just tell them $20,000? Because if I get one with them, I'll charge. So like this weird, like nobody else in our market can expect that or understands that there should be this big disparity in variety in pricing. And it came because of the insurance-based payment model. I thought over the last 20 years that demand would have pressed physicians and hospitals to build quality and pricing transparency. It didn't. It pushed them to get very, very, very good at telling our members, we can't tell you it's against the law,
right.
you just check with the plan.
Right.
And because there's no good source of information, try to go Google that stuff. And in 5 minutes, you're off at some website and you figured out you have cancer instead of something else, and there's no quality. 2 years ago, the law passed. All hospitals have to push for transparent pricing on this. I just saw an article yesterday that said about 25% of them are doing them, and the rest of them are just refusing and paying the fine. Why? Because the system continues to work without us as a society answering that question. So I'm not surprised that people don't really try to go for that because it's been unavailable. That's all a sloppy answer as to why we're here. But here's the way this plays out. If I'm ever at a cocktail party these days and somebody says, "What do you do?" I say, "Well, we're in the business of helping employees cut their healthcare costs and confusion." I'm only about 5 seconds past that, and you know this because if you go in and say I'm a healthcare consultant, they go, "Oh, here's my story." Everybody's got a story, right? And every employer and employee that we talk to who says, "Hold it, what do you do?" We actually help people find the best quality and the best price, and we're there to navigate with them and help their care coordination and find the best quality doctors. And about at that point, those people are bought in. Employers are saying, "Well, that's a no-brainer. I need that." How come my consultant hasn't set that up? How come they're completely drawn to this? Because if you ask the employer or the member, they all know that's become the biggest issue. Now, for a lot of times, it wasn't the biggest issue, but starting in 2001, it really, really, I think the pain has gotten strong enough that when we describe that to that end consumer and that end employer, they're begging for that information. Consultants, up until a couple of years ago, most consultants would say, "No, that's what I do. I'm here, my differentiator is I give great service, I have the support team." What we have heard out of consultants is, in the last couple of years, the volume and complexity of questions that are coming to them from their clients is through the roof. And their support team, I had one who said, "We keep an employee on our support team for about 18 to 24 months, and then they quit." And they go, "This was not what I signed up for, and you have no systems or data or process to help me actually answer any of these questions that are coming my way." And these are mad, mean people who are very upset over very real issues, and it's not simple to answer. So consultants thought they could get away without, because they used to address this internally.
So makes complete sense, right? Having that there, and I like the cocktail party example because at the end of the day, saying you're an insurance advisor is not very sexy. So at least this is a much sexier part of the conversation. But advocacy is a tool. We talked telemedicine. We talked advocacy. There are other things that kind of create this engagement ecosystem. What are some other things that people engage with?
Yeah, we look for things that specifically are non-insurance modules that make sense, that there's enough demand for them that it's worth rolling them in. And so some of the other modules these days, the last few years, behavioral health has been huge. So last year, one of our best sellers in the tail end of the year was behavioral telehealth with a zero visit fee, because so many employers are like, I got to take down the barriers because my people are freaking out, and they want it without a visit to the members. So we've got an unlimited version of that we can put into a group. We're just now rolling out a second opinion service. So for those high cost claims, a lot of telehealth and advocacy is about build the habits on the common stuff. You're helping the mass of employees. But of course, if you're a self-funded group, you're looking at those highest cost claims. So we've got a second opinion service that's fantastic to help with some of those and get some of the best guidance, whether it's some of the really high variability surgeries or just some of those high cost and challenging claims.
The stat that is just staggering to me is 12 million people every year misdiagnosed.
Right.
So when you think about that, it's like, why not take 4 extra seconds to have a separate pair of eyes, look at it? So it makes complete sense.
We're here. David the other day said, he was saying that he used a second opinion service for his sister with an issue that was going on. But he brought up a good point. He says, that second opinion, it's one thing if you're going to a specialist who's in the same town as your doctor, But there's a little bit of fox in the hen house, because you're going to the second opinion surgeon who might well be the very person who's going to pick it up. So are they really independent?
Right.
He said dramatically a remote virtual second opinion is where you're going to get an independent statement. I thought it was a great point.
Well, and the reality of it is if we think about how healthcare is typically accessed, people think that the only available health care to them is in their community.
Right.
And having two parents that have dealt with cancer, if somebody would have told me what I know now back then this is a no-brainer. I don't want to know who the best pancreatic cancer specialist is in Tampa, Florida. I want to know if they're on Mars, how are we getting there, right? And so that it makes complete sense from the people aspect of it, but also the financial aspect, because quite honestly, if I go see an orthopedic surgeon, to a hammer, everything looks like a nail. Yeah. Right? So what do you think he's going to tell you? Let's have surgery. That's how we get paid. So that perverse incentive thing, again, back to both sides of it, the people aspect of it and the financial prudency.
Yeah, and yeah, you're right. The people side of like, what kind of guidance do they really need in that process? And it's handing that person some of the right language to go back to their doctor and have that conversation. And so that's engagement, a piece of that.
Right, advocacy.
And then one of the other modules is virtual primary care. We see, people have gotten very used to telehealth for the urgent care stuff. Behavioral telehealth was a very obvious next category. And now can we take the urgent care kind of telehealth, but actually allow it to be that you picked a doctor, you're building a relationship with them, and it becomes, a lot of conversation here about direct primary care, and while that's fantastic in some groups, and you'd never put a virtual primary care into a direct primary care,
right,
you might put it in there that if you have direct primary care for the core employees who work inside the city, and then maybe you got a multi-state, so let's get them some virtual primary care, so at least you've got a comparable.
Yep.
Or more common, probably what we're seeing right now is if you weren't going to install a direct primary care, but let's say you've got that population that's got like 40% of their employees don't have a PCP, let's get them somebody to talk to. Because if they don't have a PCP, let's get them somebody that they can consistently chat with, so that we can make sure that we're taking care of some of those chronic care issues, et cetera. So that it's these various modules that you can pull on. So it's kind of fun to see what this ecosystem that we've created has grown into.
Yeah, so consumerism.
Yeah.
In my opinion, we used to think it was an HSA and a high deductible.
Right.
Right. And now the word, in my opinion, is the answer of solving healthcare. Unless we change how the person who is the decision maker looks about how they solve whatever needs that they are. Until we change that they're thinking twice, like we have in every other aspect of our business.
Right.
We're never going to do that. So it makes such sense when we talk about, right, these different tools, give it to them when they need it, make it easy, blah, blah. But the reality of it is, and I joked about this off the stage yesterday, right? All of us combined here that wake up every day swimming upstream and promoting all of these things, we have a combined market share of, a fraction. Why? Why is it so when you're sitting across an employer and they hear all of this, I think of it like, duh, like why didn't we do this 10 years ago, right? And all this stuff, but what is the obstacle that typically you find when you go through this spiel and the person that says, yeah, I don't want to do it, what is the why behind that they don't want to do it? I'm curious about that.
We don't find employers say they don't want to do it.
Okay.
We find consultants who either are closely involved with their people, and for them it's a matter of more, what's going to be the right time?
Okay.
People don't question whether this is valuable. They question, is this the right time, or how's that going to play out in my group? But a lot of it is how the consultant describes what the value of that's going to be to the employer. So I was just talking with a broker who's worked with us for a couple of years yesterday, and I said to her, when you're talking to your clients, explain to them your value equation, which is, for her, it's a very high service, like we're here to help you through this, we're going to bring you some different ideas than maybe you've heard elsewhere, And we spoke about just start to weave in that when you work with us, we make sure your people get guidance towards how they're going to engage with the best quality care. We know that we're going to have to get something that's in budget for you, but as part of being in budget, we're going to have programs that include no-cost telehealth for those that need it. That's going to save them some money. We're going to make sure that people aren't overpaying for healthcare if they could have gotten something better elsewhere. And it's just part of the service that we're going to set up for you. And in that way, that consultant is talking about what they're going to bring to the table for that employer, and that they're not saying, hey, I'm going to do this, or they're not saying, I'm going to install Freshbenies. Because then you've confused the end client on, well, what's this thing? And oh, this is another thing you're trying to jack me to pay for. And rather, talk about it as this is the experience that your employees are going to have. When we look down a year from now, more of them aren't going to have paid as, less of them will have paid as high out-of-pocket costs as they have. So even though maybe we, in one way, are pushing consumerism that their out-of-pocket cost is there, we're going to make sure they're getting better quality and in these ways lowering the cost. And so it's more of shifting the way that you talk about it, that it's 2023, from here going forward, every plan is going to need some of these modules, and we're bringing this as a solution.
Well, it's strategy versus product.
100%. And it doesn't mean that every group immediately grabs on.
Sure.
You know, we've learned a ton about what we can do for turnkey engagement. We coach consultants on here's the things that we know work for a good install, and we grow them from, 9% engagement on advocacy usage, and when we're talking percentage engagements on any of this, we mean like, okay, for every 100 employees, 9 times a year somebody engaged with us, or we get them up. We know if we get up around 20, 25%, it's sort of one of the tipping points. That momentum is starting to build.
Sure.
There's enough people who are starting to talk amongst that
water
group.
cooler talk, yeah.
Exactly. And then, what's the potential? It should be way over 100%, because what you want is the mass of people.
The people that are doing it, that do 7 times a year, they're on it all the time.
That's right. And then as the underlying plans change, people don't have to learn about, I've got to download this new app for customer service at this plan versus last year's plan. I'm still just calling Rachel, because Rachel's my advocate.
Got it.
You know what I mean?
Got it. So we said, and I just said, kind of that strategy and the conversations there. I want to end this conversation with the personification, right? That employer, that member, that story that when you think about it, it brings a smile to your face, because entrepreneurs don't do this for the money. Right, I mean, it's true. I mean, we could be making money doing a lot of different things. We do this.
That was years before I ever made money.
Right, exactly. I made more money when I was 30 than I do now. But I was doing it the wrong way then, and now doing it the right way, it's just even harder. But I could tell you those 5, those 10, those 15 stories that happen every single month that just light me up. And talk about one of those stories that just bring a smile to your face. That really tell you, hey, what we are building matters, not because it's having a nice lifestyle, it's because we're changing and we're impacting lives. Talk to me about that.
Yeah. I'm thinking about one client who it's always tough from a carrier a solutions provider standpoint when a consultant or a broker loses a case to another, and especially as a unique innovative supplier like us.
Right.
Everybody's got their favorites. Sometimes, we're quickly on the phone to figure out who's the new person. Is it somebody we know? If it's not, we know there's sort of 50-50.
High-end alert.
They're going to prove they know something better.
Yep.
I mean, it's the job, and it's the game, and it works coming towards us, and it works going away, right?
Yeah.
But it's always a tough one. So last year we had a group, there's about 400 lives. They float through the year between 300 and 500. They work in marketing and multi-channel marketing engagement and stuff. So very popular kind of company. White collar for sure. They had been on this, their first consultant had them on some complicated self-funded plans, and there was a lot of noise, and they got frustrated with the way that was being built. So they switched brokers to a very large national brokerage. Two of my team were on the phone with that consultant, and they said, "Wow, the plan is the group is so mad at this self-funded build out and the pain that was occurring from their employees, but they actually have said the one thing that they really loved was that Freshbenies was here, and that their people always knew where to call and how to get some guidance. They were running, I told you 22% is what we always love to see a group get to there and past.
Okay.
This group was running at about 100% utilization.
Wow.
So for the 400 people that were on there, they were having about 400 full episodes with our team. That's
Wow.
not like calls, that's
Right.
like full episodes of care and guidance. And they said this is the one thing that they want to keep going, and the consultant said, well, what we're doing is, because there was so much pain with this, our answer is we're going to move them to a fully insured plan, and since we're moving them to a fully insured plan, there's not going to be a need to have an advocacy program. And the person on my team, I just love her. She's so smart and savvy of watching this and understanding the people aspect. She says, okay, so these people are mad because of the way they're interacting. You're going to change their entire plan on them, and you're going to take the one thing that they're actually using, which is the constant of who to go to ask how to use this new plan, and you want to push that off to a carrier's customer service department?
Right.
Because here's the thing we know. 2 years from now, you're going to put them back on a different version of a self-funded plan.
Right.
Why don't you keep this as consistent? And the light bulb went on for the consultant. She's like, oh, yeah, I would have never thought of that. And she'd never really looked to a fully insured, like how helpful that was for the people. Because it's working. Why are you going to take that out of there?
Right.
What happened was, a few months later, they actually switched consultants again. So here we are with the third consultant, and all of that was in less than a 12-month period of time. And yet we're still in there. They're still using our tools, and our advocates are still there guiding the people. And I just love that as a story, because otherwise all of that was a bad situation for the employees, and they're the ones who would have had far more disruption than they would have had. We look at it from the perspective of the broker. We go, oh, that's bad for all the broker disruption. How about the 400 employees?
Right. No, it's such an interesting thing, because at the end of the day, when you look at the options out there, when you look at it, there is, in my opinion, there is no lack of innovation that is happening in this space. That advisor is typically the choke point, right? I mean, you get to talk to more employers because more innovative advisors put you in front of there, but that's the scenario there. And so when you think about that, you know, employers couldn't get to a great solution that's actually helping their employees if they're not picking the right thing. So it's such an interesting dichotomy of like distribution, innovation, and how the messaging is out there. You know,
employers find out about it and they'll ask their consultant, and there's a 50-50 chance the consultant's either going to completely do everything they can to discredit it, even if it was a good idea, because they're just embarrassed that they didn't bring it, or they're going to say, oh, that's intriguing, and go do some research. But the consultant is absolutely necessary in the process. Imagine trying to do this just as an employer without spending every minute of every day trying to figure out what are all these different solutions and what's the best way to have them work together. Because what worked a few years ago does not work today.
And what works today won't work tomorrow.
It won't. It's going to keep changing.
Leave us with that one thing. If you're got an audience, and let's go the audience's employers. What's Reid's last, 1 minute spiel to an employer population? Like, knowing the pain that they're going to, we're in an inflationary period as we're recording this in the beginning of 2023, right? We're in an inflationary period. Healthcare costs continue to go up double digits every year. I mean, that's not stopping. What do you tell employers out there?
The purpose that we started our company with in 2009 was very applicable to about 10% of the population that was out there on employer plans. And today, it's upwards of 90% of the employers are struggling with this. All of your employees are struggling with this. There is no future where this becomes simpler. And so regardless of all the moving and changing and government and an insurance carrier does this, or a consultant comes up with a brilliant idea, there's nothing about the future where this is getting simpler and just getting solved with a simple little Yelp app for healthcare. It's just not. And so You will have advisors for your people. It's not going to be the HR department at your company because you can't keep up with it. And as it is, your people aren't happy with the experience. And we can have a better experience together. But that's it. I don't think there's a future where you don't have some guidance.
And the definition of insanity, right? If we keep doing the same things we've been doing, which is not giving employees any tools, any advocacy, any engagement, any of that, we get the results, right? And
That's right.
Yes, this may be more difficult. Meaning, like, there's more stuff. There's more people to talk to. At the end of the day, you're solving that, and that underlying ecosystem does produce results. But the buy it off the shelf, all from one carrier that's got a nice logo that everybody recognizes, isn't necessarily always the answer either. So I just love the both sides of the message, right? Because the reality of it is it's not going to get any easier, and the reality of it is to fix it, unfortunately, sometimes does require a couple more tools, and just like a project requires a hammer, a saw, and a nail.
You've got this podcast called Impact Healthcare. And the reason that you continue to have new episodes is because there are so many necessary moving parts on this.
Yep.
It's 1/6 of the entire American economy, and it is never getting smaller. You'll have podcasts forever to talk about some of the different approaches. Somebody needs to find a good consultant who truly is figuring out what do they need this year, and in that way.
Awesome.
There's no end to it.
Well, Reid, if somebody wanted to learn more about Freshbenies, keep up with you, where do they do that?
Well, freshbenies.com, it's Bennies with Benies,
Okay.
one N, not two. And I'm prolific on LinkedIn, can catch me there. And my email and phone number are public. So
Awesome.
Reach out to us. Somebody off our team would be happy to chat with them.
Awesome. Well, to the Impact Healthcare crowd, if you want to be part of our text community that you get a message every time we drop a new episode, you will see the text number below. Reid, thank you so much for trying to create a easier ecosystem, or at least entry point into the ecosystem, because again, I've done this my entire career. I have spent time dealing with both of my parents through their cancer journeys, and never did we have an advocate, like never did we have anything. And so I just look at this as like, again, forget how much money it can save somebody. Let's just talk about it in the humanistic standpoint, right? It is just the right thing to do. And so I really appreciate that. To our crowd, thanks for listening, and tune in to the next episode. We'll see you later.
You've been listening to Impact Healthcare, people and strategies that are disrupting the health benefits industry with Lester Morales. Remember, the journey to getting 20% savings on your healthcare benefits starts with total transparency. Remember to subscribe to the Impact Healthcare podcast on iTunes or wherever you get your podcasts.